Hi, this is our presentation on nurse retention issues in the hospital setting. My name is Ashley Tedder and I'm going to be doing the first part. So what is nurse retention? Nurse retention focuses on preventing nurses from turning over and keeping nurses in their current employment setting. This is a current problem in the hospital setting. This comes a heightened issue when there's nurse shortages. And as you can see, over the past couple years, from 2010, the turnover rate was 13.8, and in 2014 it was 17.2. So it keeps increasing and it's becoming more and more of an issue. So economic concerns. So nurse turnover, the first thing that you probably think of is it's costly, and it is. Nurse turnover ranges for about $22,000 to $64,000 when a nurse decides to leave. So when a nurse does turnover, there's advertising costs. They have to advertise that position again. There's beds closed, staffing issues. They have to hire and go to a new orientation for the new nurses. They have to think about patient errors and compromised quality of care if there's not enough nurses. And there's loss of organizational knowledge. So non-economic concerns. There's several benefits of retention, and patient safety is one, patient satisfaction, nurse satisfaction, and nurse safety. Everyone likes to come into work when you're properly staffed, and makes it for a better work day and makes the nurses happier and the patients. So one study showed that that when organizations have low turnover rates, that the patient quality of care is better, and patients actually stay less, like not as long in the hospital setting. And that's it.
Hello, I'm Tammy Langrel, and I have the next part of this presentation. So one form of leadership that has been found to be helpful with the issue of retention is transformational leadership. This type of leadership was introduced by James Burns and is described as a process in which leaders and followers help each other to advance to a higher level by using morale and motivation. This type of leadership has been found to increase retention. Leadership styles, especially transformational, that encourage staff involvement increases the chances of nurses remaining at their jobs by as much as 17.4%. Some of the characteristics of a transformational leader are they're able to motivate people to accomplish change, they lead by example, they're very optimistic, they are able to offer positive incentives, they're good at creative thinking, and they're visionary.
Hi, I'm Miley, and I'll be talking about some interventions and causes of nursing retention and nursing turnover. So as Ms. Tammy said, one study found that leadership behavior was directly correlated with staff turnover retention. As Ms. Tammy also said, transformational leadership raises the aspiration and motivation of others to high levels of ideals and values. Recognizing these causes of nursing turnover and promoting nursing retention is important for quality of care. So nursing turnover causes. One thing is a poor work environment. If the nurses feel like they're not getting enough help or they're causing risk of patients' health, they don't feel like they want to stay, they want to leave. If there's a strained relationship between the coworkers and the managers, that's a high cause of turnover. Nurses who are overworked and burned out, they're working overtime, they feel too tired to even want to work. The lack of recognition and lack of opportunity of growth causes a high turnover. So interventions for promoting nursing retention. One is to foster a positive and motivational workplace. So building that teamwork is a good way to keep nurses in their jobs. Establish an open communication. Employees must feel comfortable enough to discuss any issues that arises. So leaving an open door policy for the managers so the nurse can feel comfortable with talking about any issues with other coworkers so that the manager can fix any of that. Be available for the nursing staff. Always make sure that the nurse doesn't feel like they are behind on everything so that they can talk to the manager or the nurse, charge nurse to help them to catch up on the work. Encourage educational growth through the tuition, helping tuition, or being available for them so they can be able to take that class that one night every night a week and so forth so they can pursue other career options. Recognize hard work. If the nurse is doing extra work, taking overtime slots and all that, they should be recognized for their hard work. And provide support for scheduling shifts. If a nurse doesn't feel like they can pick what days they can work, they feel like they can work somewhere else that offers them those opportunities. And these are our references.